Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk about the concept of an intellectual disability, which is sometimes referred to as an intellectual developmental disorder. So without further ado, here we go. So let's start with some foundational concepts. What is an intellectual disability? Well, an intellectual disability is when a person has deficient intellectual functioning in areas of problem solving, abstract thinking, etc. Oftentimes, this is quantified using an intelligence test where an individual's IQ is 70 or lower. However, IQ alone is not sufficient to meet the criteria of an intellectual disability. So we need to also tap into some of the areas of adaptive functioning, such as communication, home living, self-direction, safety, etc. And these symptoms must have appeared before the age of 18, right? Because this is a developmental disability, and we should be able to detect it. Now, just as an aside, when we talk about developmental disabilities, it's much broader than just an intellectual disability. A developmental disability could include things that are also purely physical in nature. So I thought I would, add that to the mix, because this is just a subtype. So how do we assess intelligence? Well, a clinician's going to administer an intelligence test, and then a person is going to perform a whole host of, we call them subtests, different tasks, and we're going to score their performance relative to a person of their age group. And based on that, we can determine whether their intelligence is equal to, greater than, or below their age mates. And in order to have an intellectual disability, as I mentioned before, the first criterion is that the IQ has to be 70 or below. Now, what happens if a person does not perform well on one or two of the subtests? It isn't going to impact a score on intelligence all that much, because we take all of the subtests and we calculate what is considered more of a global measure, which we call IQ, right? And that is your general intellectual ability, not just how you performed on some of the subtests. But IQ alone is insufficient to diagnose an intellectual developmental disorder. So for a proper diagnosis, clinicians also need to observe adaptive functioning. And there are tons of instruments you can use to measure adaptive functioning. There's the Vineland Adaptive Behavioral Scales. There's the AAIDD's Adaptive Behavioral Scales. And then there's the Adaptive Behavior Assessment Scales, or the ABAS, which is the one that I commonly use. So you're probably wondering, well, what are areas of adaptive functioning? The ABAS is going to have three general larger buckets. There is conceptual skills or abilities, and that's language and communication. That includes things like academic skills or literacy, things like self-direction, whether they can drive a task on their own or do they need support. And then in the social arena, we look at interpersonal skills, things like that, and how well a person solves social problems, right? And then in the practical arena, there's a lot more, but we have things like activities of daily living, things like grooming or personal hygiene, things like safety, being aware how to avoid an accident if they're walking across the street, or being aware of fire safety, or not talking to strangers. These kind of practical skills are going to indicate how independent this person can function. So these are 3 domains and some of the sub skills that we look at. So what are the features of an intellectual developmental disorder? Well, the most common feature you're going to see is IDD affects learning. So people with an intellectual developmental disorder, they oftentimes learn very slowly, but we also see issues with attention, memory, planning, and language and communication. Now, let's start to try and understand how we categorize an intellectual developmental disorder or an intellectual disability. This standard traditional categorization is mild, moderate, severe, and profound. And there are IQ cutoff scores that map onto it. But the American Association on Intellectual and Developmental Disorders uses a different categorization system, but technically it does map onto it, and they look at the level of support categorization. So I'm going to talk about the IQ, what we tend to see, and then I'm at the bottom, I'm going to add what the AAIDD uses in that specifier: mild, moderate, severe, or profound. So here we go. So a mild intellectual disability, first of all, this is the most common scenario. 80 to 85% of people who meet the criteria for an intellectual disability or intellectual developmental disorder, they're going to have a mild specifier, because the IQ range is anywhere between 50 to 70. And because it's mild, oftentimes we don't detect it right away. So we will detect it when a child's starting to enter elementary school and they have some deficits in cognitive ability. Now, one of the challenges we face with IQ testing in general is that there is a cultural element. Some of the items are culturally loaded towards a white middle-class community. So we do see poorer performance among individuals of minority groups, and we argue that there's a potential overrepresentation. So the AAIDD, instead of calling it mild intellectual disability, they would refer to it as an intermittent level of support, and I'll explain what that means as we go. So mild IDD is typically caused by sociocultural psychological factors such as an unstimulating environment, poor parenting child interactions, inadequate interactions, deficiency in the early learning experience, not giving the opportunity. That being said, even though sociocultural and psychological factors are the dominant indicators, we do see some biological factors at play, such as drugs and alcohol use and malnutrition, play a role into the development of a mild intellectual disability. So moderate intellectual disability, that would be an IQ between 35 to 49. That's approximately 10% of the cases. And this is detected during the preschool years. Notice the more severe the intellectual disability, the earlier we're able to detect it. So I wouldn't say the vast majority, but many people with Down syndrome or trisomy 21 oftentimes land in this categorization of mild intellectual disability. And the AAIDD labels this as a limited level of support. So what does that mean? I said I would come back to this. Individuals with mild and moderate intellectual disabilities, they can care for themselves. They can benefit from occupational or vocational training. and they can work in either unskilled or semi-skilled jobs and be productive and live semi-independently. Whereas when we get to the more severe and profound intellectual disabilities, the level of support is increased and the level of independence is decreased. So let's talk about severe intellectual disability. This is an IQ of 20 to 34. This is roughly 3 to 4% of the cases, usually linked to more biological or organic causes. And we can detect this very young, even before preschool. And the AIDD would label this more of an extensive level of support. And typically, that means that they require careful supervision and only very, very basic tasks can they do. I know I mentioned in mild and potentially moderate level of intellectual disability, a person can live independently or semi-independently, and they have these shared housing arrangements where people could live. When it comes to severe intellectual disability, these individuals struggle to live independently. They rarely can do it on their own. They need more extensive level of support. And then profound intellectual developmental disability, that is an IQ below 20. This is only about 1 to 2% of the cases of IDD. We usually are able to detect this in infancy, right? So as early as 6 months, we're starting to see something is off, right? And we typically see a combination of medical conditions that co-occur. So it's oftentimes the intellectual developmental disorder is part of a larger syndrome. So individuals with profound intellectual developmental disorders, oftentimes they can learn some basic skills, but need a very, very structured environment. And then AAIDD, they label this a pervasive level of support. So I hope you found this video useful. As a recap, you learned what an intellectual disability is. The 3 hallmark features are an IQ of 70 or below, plus at least 2 or more areas of adaptive functioning that are not up to par, plus, so all 3 of these must be met, the symptoms manifesting prior to the age of 18, right? Because it is a developmental disorder. So that is what an intellectual disability is and the criteria that need to be met. So IQ alone is not sufficient to label an intellectual disability. So we need to have more things going on. So we learned the diagnostic criteria. We learned some nuance in how we specify it. So if we were to look at the traditional labels, we have mild, moderate, severe, and profound intellectual disability versus the AAIDD, which has a different classification that focuses on level of support. I hope you found this video useful. If you learned something, hit the like button, subscribe, click the notifications tab. I'll be producing more and more of these videos. Until next time, take care, everybody.